So we've covered what electricity is and how it works. Let's look at some of the injuries we'd expect to see in an electrocuted patient. So the number one most lethal injury we have to worry about is arrhythmias. It takes a very small amount of current, like 100 milliamps, to put a patient into VFib. This is concerning enough, but even more so when electricity is likely to cross right through the heart as it heads to the ground. Next thing to worry is respiratory arrest. Electricity crossing through this brainstem can knock out our respiratory drive, or the electricity can cause spasms in our diaphragm, making us unable to breathe. Fortunately, this is typically transient, and as long as we can breathe for them for a little while, they should start breathing again on their own. Burns are another injury we need to be concerned about. Remember the term resistance? It's essentially the friction that electricity feels as it travels. So as electricity enters the body, typically through the hand or the foot or the head, it feels resistance from the different tissues it travels through, and that resistance generates heat. Areas that have low resistance, like nerves or blood vessels, typically don't burn or generate as much heat as areas like high resistance, like bones or joints. When looking at electrical burns, make sure you look for source and ground injuries, where the electricity has entered or exited the body. When thinking about electrical burns, we also need to consider the body's surface area that's affected. Grabbing a wire with our hand will cause some burns all over the palm of our hand, but if a child put that same wire in their mouth, being a much smaller surface area, the burns will likely be much more severe. Some more long-term effects of electrocutions would be muscle damage from the tonic-clonic motions, or even some rhabdomyolysis leading to kidney failure from damaged muscle proteins clogging up the tubules in the kidneys. Lastly, there can be some cognitive, sensory, and motor, and even behavioral changes from electrocution, and these can have prolonged effects on the patients, with some patients never returning to normal. The last thing we need to talk about is lightning strikes. While it's still pretty rare to be hit by lightning, it's something to take note of, as there are approximately 30 deaths per year in the US related to being hit by lightning. So lightning is a lot different than household or industrial generated electrical injuries. First, the voltage and amperage is much higher, getting over 100,000 amps. While that would typically make the injuries very severe, lightning is only in contact with the body for such a short time, a thousandth or a 10,000th of a second, that the electrical injuries are often pretty mild. Very rarely will lightning injuries cause burns of the skin, because there just isn't enough energy being transferred in that time to generate any heat. Sometimes a unique pattern called Lichtenberg figures can be seen on the skin. This is caused by an inflammatory response from a lightning strike. The fern-like pattern will typically resolve within a few hours without treatments, but some patients are left with permanent pigment changes to their skin. When we look at people who have been hit by lightning, we tend to classify them in a few ways: either a direct hit, a contact injury, side splash, where the electricity jumps from a nearby object to the patient, or a ground current, where a patient is shocked by the electricity that is dissipated into the ground. Ground currents are the most common types of lightning injuries. Cardiac and respiratory arrest can be seen in lightning strikes, but due to the automaticity of the heart, they are usually temporary. The heart will typically restart on its own, and usually in sinus bradycardia. It makes for a counterintuitive situation for triage, though, where in the cases of lightning strikes, we'll focus on treating the patients in respiratory or cardiac arrest, and then work our way out to the other patients. From a neurological perspective, lightning strike can cause altered level of consciousness, seizures, or amnesia, which again will typically resolve shortly after the injury. It's often that patients will experience a unique type of paralysis called a choranoparalysis. It affects the lower extremities, causing paralysis, vascular spasm, in which the patients present with pallor and lack of pedal pulses. Be sure to check a carotid pulse before starting CPR in these patients. Typically, this type of paralysis will last for a few hours with no long-term deficits noted. Lastly, while the lightning itself doesn't typically lead to large trauma, the force of getting hit can often throw a patient, causing head and spinal injuries. Also expect to see types of barotrauma, like ruptured eardrums, from the rapidly changing air pressure due to the lightning.